Why is TB an opportunistic infection in HIV? Have you ever wondered why tuberculosis, or TB, is considered an opportunistic infection in people living with HIV? The connection between these two diseases is significant and complex. Understanding this relationship is crucial for effective treatment and management. HIV, or human immunodeficiency virus, primarily targets and destroys CD4 T lymphocytes. These cells play a vital role in the immune system, helping the body fight off infections, including TB. When HIV depletes these cells, the body becomes less capable of controlling latent TB infections. This leads to a higher risk of reactivation, where dormant TB bacteria become active and cause disease. In fact, individuals with HIV have a dramatically increased annual risk of developing active TB compared to those with a healthy immune system. Another factor is the impairment of macrophages, which are immune cells responsible for engulfing and killing TB bacteria. HIV alters the function of these cells, making them less effective. This change reduces their ability to produce nitric oxide, a crucial molecule that helps kill TB bacteria. As a result, TB bacteria can survive and replicate more easily in the body. HIV also disrupts the formation of granulomas. Granulomas are clusters of immune cells that typically contain TB bacteria in a latent state. When HIV affects the production of important signaling molecules like interferon gamma, it weakens the integrity of these granulomas. This allows TB bacteria to escape immune control and progress to active disease. Interestingly, TB infection can also stimulate HIV replication. When TB is present, it triggers immune activation and the production of pro-inflammatory cytokines, such as tumor necrosis factor. This creates a cycle where TB accelerates the progression of HIV, while HIV further weakens the immune response against TB. Co-infection with TB is associated with higher HIV viral loads and increased immune activation markers. This combination leads to faster progression of HIV disease and more damage to the immune system. The environment created by this co-infection makes it easier for TB to reactivate or for new TB infections to occur. HIV also affects other immune cells, like CD8 T cells, and alters the movement of these cells to infection sites. This further diminishes the body's ability to mount an effective response against TB. In summary, TB is classified as an opportunistic infection in individuals with HIV because the virus severely compromises the immune defenses necessary to control TB infection. This results in a higher susceptibility to both new TB infections and the reactivation of latent TB. Addressing both infections simultaneously is essential for effective management and reducing the risks associated with co-infection. Always consult healthcare professionals for personalized medical advice and treatment options.